parents smoking, no seatbelt, sitting in that back seat with cars coming right at you. But this generation, y'all don't know how good y'all got it. So please welcome to the stage, Caffee and Associates.
All right, guys, bear with us a minute. We're waiting on our PowerPoint.
Good afternoon. I hope everyone's doing well and had a great lunch. We are with the BU Tobacco and Vaping Free Prevention for the youth. We are the youth addressing the pollution prevention. I am Cadence Atkins, a youth leader at Petal, Mississippi.
I am Anicia Shannon, a youth leader in Jackson, Mississippi.
I'm Asia Jones, a youth leader in Towala, Mississippi.
And I am Ebony Jones, a youth leader also, well, a regional assistant from Towala, Mississippi. First, we would like to give a special thanks to our leader, our founder, and the CEO of Caffee and Associates Public Health Foundation, Ms. Brenda Bell Caffee.
So our main focus is not only the use of tobacco and vaping products, but also their waste. The way that we disregard and discard these product waste is very important, especially to our environment. These products often end up in our storm drains, which makes it very hard for our water to be properly and appropriately drained and filtered, which leads to buildup in our water, which goes through our water systems, and we eventually end up consuming it in our daily routines. The first step to assessing and trying to fix this issue, the water crisis, is to educate ourselves, which we did this by meeting with we partnered with the director, Deborah Veeder, the owner of Adopt a Stream, and she helped educate what is the water crisis and how it's been happening. And through this, we learned what it is and how we can prevent it and how it's been happening. And therefore, us learning it and educating ourselves, we were able to educate our youth and our community so we could help assess and fix the issue.
So the next step was identifying the issue. So we went out into our own communities and took pictures of storm drains right in our backyards and in our Gulf Coast in Mississippi. As you can see, in all of those places, there is tobacco, there is cigarette butts, vape cartridges just placed around, and it's becoming a serious issue statewide. As you can see the cigarette butts, the vape cartridges, which has just been placed all over the state of Mississippi and in our own communities. And it's becoming a big problem because for Mississippi, it's becoming a statewide issue because it's becoming a reoccurring thing that you can see in our communities, which we don't want.
After identifying the issue, we connected with like-minded individuals through partnership, raising awareness, participation, and developments. So we partnered with Adopt a Stream, the Mississippi Department of Environmental Quality, and surrounding counties to stop and have April 22nd, which is Earth Day, and we came up with a Clean Up Mississippi Day in conjunction with Earth Day. So, hey, let's get together, let's clean up Mississippi, let's clean up our waters, let's keep where we live clean. We raised awareness by distributing different information packets filled with good things about what we're doing in our community, letting the people know what we're doing, getting our message across. We participated, as you can see in the background, we turned our storm drains into art. So after cleaning off the storm drains from tobacco waste, or tobacco product waste and vape product waste, we made our drains beautiful again. We made them pretty. And like I said, we developed Mississippi Clean Day in conjunction with the Earth Day weekend. So now in Mississippi, when it's Earth Day, it's also Let's Clean Mississippi Day. I was actually a part of the first cohort with BU under Miss Caffee, and we didn't have a name. This started 5 years ago. We didn't have a name at the time, just a group of 14, 15, 16-year-olds eager to make a change in our community. Through the years, we have built our program, made our name known. So now when they know or when they see BU, it's a group of youth in the community changing our community. We advocated and engaged with decision makers in our community. So picture, wait, let me see. Okay. Yeah. We advocated and engaged with the decision makers in our community. On the left, you see Mayor Nicole Rosebud. She is the mayor of Toe Island, Mississippi. This is my hometown, deep in the Mississippi Delta. You probably don't know what it is. A small town that is affected dramatically by the tobacco products, the harmful effects of it, and even more impacted by the waste of it. On the right, you see Councilman Blake Nobles from Petal, Mississippi. We went out, we told the decision makers in our community our objective, our goal, our mission, what we wanted to do, how we wanted to carry it out, and they helped us get it done.
We had the opportunity to go throughout the states and identify the drains that were most affected. The efforts to clean up these drains are on the way, and when they come, they are going to have a huge impact on all of our communities.
What's the next one?
These are some of the examples of the drains that have tobacco products in them. We put decals on them after we clean them, so we know that it is monitored and clean, and so we know we can move on to the next one.
We are the Mississippi Youth in Action, cleaning our communities one drain at a time. When you see our drains or you may not come to Mississippi, but if you do come, to Mississippi and you see a decal, let me go back so you can see the decal. You see our decal that says no dumping, this drains to waterways. You know that the BU youth leaders have encouraged those in the community to also accomplish the same mission that we're accomplishing. Actually, in these pictures, the four of us are pictured along with Nicole Banks, our program director. We actually went out to a storm drain in Byron, Mississippi. I'm not sure if you guys know where that is either, but it's a small town that is also greatly affected by the tobacco products waste and the vape products waste. We cleaned it up. We marked it with our decal. We would like to thank you guys for giving us the opportunity to be here. We would also like to give a special thanks to our program director, Latasha Rice, and our program youth project coordinator, Nicole Banks.
Let's give these young ladies another round of applause. For the youth of our nation taking over, taking things in hand. You might have noticed that there's a purple table right outside this door right here, and that is the Decision Informational Resources table. And basically what they're doing is they're taking testimonials from you throughout the conference to help us better do what we do. Does that make sense? So please take time to hit that table before you get out of here. And now it's my great pleasure to introduce the Executive Vice President for the Campaign for Tobacco-Free Kids, John Bowman, one of our sponsors here. Thank you so much for being here.
Good afternoon. We are thrilled to be here in support of the Center for Black Health and Equity and at the State of the Black Health Conference. The Campaign for Tobacco-Free Kids is committed to eliminating tobacco-related health disparities, and we are honored to partner with CBHE in this fight. CBHE has been a leader in the fight to eliminate menthol cigarettes and advance health equality, save lives, especially Black lives. And we are as close as we have ever been to getting these dangerous products off the shelves. But as we know, the industry will do everything they can to keep their products on the shelf. The industry has been targeting our community for over 60 years. It spent billions to market menthol cigarettes to us, portraying them as cool or glamorous, also sponsoring community events and music events like the Cool and Newport Jazz Festivals, and even going as far as handing out samples in the Black community. Today, the industry is working just as aggressively to mislead the Black community, to hoodwink us, if you will, about the impact of banning menthol. They exploit one of our biggest concerns, over-policing in our neighborhoods. I want to be clear, racial biasing is a serious problem that must be addressed. But the tobacco industry's targeting of the Black community with menthol cigarettes is also a serious problem that must be addressed. We can chew gum and walk at the same time. We can continue to speak about over-policing in our communities. It's absolutely critical that we do so, but we can continue to say that we don't want menthol cigarettes in our communities because they kill too, and at a higher rate. TFK is all in on this fight. We are working with our partners in cities and states across the country to ban the sale of menthol cigarettes and other flavored tobacco products. We're also working with our organizers to support the FDA's proposed rules to eliminate menthol cigarettes and flavored cigars. We have reached out to a lot of non-traditional partners to get them engaged in this space. Our coalition is broad and diverse and bigger than anything that the industry can put up against us. I also want to touch on what these young ladies were mentioning just a couple of seconds ago, the industry's continued attempts to addict a new generation to nicotine with e-cigarettes. Youth e-cigarettes use is a public health crisis. The 2022 Youth Tobacco Survey showed that 2.5 million middle and high schoolers regularly use e-cigarettes. One of the most alarming things about that study was that 46% of high school e-cigarette users use them frequently. That's more than 20 days a month. 30% use them daily. It's not an accident. This is powerful evidence, too, that the kids aren't just experimenting with e-cigarettes, they're becoming addicted to these high nicotine products that are dominating the market right now. It's not a surprise that kids are regularly using them. The industry is marketing directly to them. Just last week, we saw the FDA issue warning letters to 15 online retailers for selling illegal products packaged as things that appeal to children, like toys, school supplies, and drinks. They're selling products that look like SpongeBob SquarePants, Super Mario, in the shapes of highlighters and popular drinks. Just as they always have, the industry will do anything they can to lure our children into a lifetime of nicotine addiction. It is unacceptable that 2.5 million kids use e-cigarettes when the solution is clear. Eliminate flavored e-cigarettes. 85% of youth e-cigarette users use flavored cigarettes. The FDA can and should eliminate these products immediately. We want to thank you for your work in the partnership in advancing health equity and saving lives, and we look forward to creating a tobacco-free generation with you.
Thank you, John, and thank you for your support. Next speaker coming up is joining us all the way from Zimbabwe. She'll be talking to us about the groundbreaking public health intervention known as the Friendship Bench. We'll learn how this program is creating safe spaces and a sense of belonging in communities to improve mental well-being and enhance the quality of life. Please welcome to the stage, Zvikomborero.
Thank you so much for the effort to pronounce my name right. I really appreciate that. We had a little caucus before it started. Like, I want to make sure that I get it right. So I really, really appreciate it. So my name is Ziko. My full name is Zvikomborero Tsiga. I'm coming all the way from Zimbabwe, and I work for an organization called the Friendship Bench. I was sitting with Bronwyn, and she says I win the award for the most hours traveled to get to this conference. So I'm looking forward to my medal at the end of this. Yeah, and this is my first time over this side of the Atlantic, and to be in this space, sharing space with you guys, with this community. I'm really honored. And on behalf of our founder and CEO who couldn't make it, I'm so glad to be representing him and the Friendship Bench today. So the work of the Friendship Bench, okay, this is the clicker. Is this the clicker? All right. Let me practice to see. Okay, good. Cool. Let me just leave it there. So the work of the Friendship Bench is really premised on an imagination or imagining a world where everyone, everywhere, has somebody they can tend to for their mental health, right? Where community or where people who rely on connection. So our imagination is thinking about if everybody everywhere could have somebody they can tend to for their mental health needs. And what brings us to spaces like this, beyond mental health, is to know that that world that we imagine is possible through our collaborations, through meeting up in spaces like this, inspiring each other, coming up with new agendas, new goals, right? So I'm really, really honored to be part of this community that is thinking about health, mental health, public health for the Black community. So I'm really, really honored. Thank you so much. And then to the Friendship Bench and sharing what our model entails. So first of all, actually, context is key, right? Context is key for us. And if I could share with you some statistics, which some of you might be aware of already. An estimated 450 people worldwide suffer from mental illness, but 0.0, if we could say, have direct access and information on the health services for mental health. If we're bringing it home to Africa, the continent has one psychiatrist for every 1 million people. This creates a massive treatment gap, right? And in Zimbabwe, in my home country, the rates of male suicide are higher than any other country in the region. And to bring it even home to this space that we're occupying, research has shown that Black people, people of color, brown people, have difficulty accessing mental health services and experience discrimination and overdiagnosis of acute mental health conditions such as schizophrenia and bipolar. So what does this mean for us in this context? And some of the grounding questions that I'm going to share with you have inspired the work of the Friendship Bench, which is, what do healthy, thriving communities look like for Black people, people of color, and those that are at the margins of society? How do we destigmatize the talk of mental health? How do we continue to raise awareness? How do we improve health-seeking behavior within our community? What does equitable access to mental health services look like for our community? How do we innovate within our context to ensure that mental access to mental health is for everybody? And the questions I pose, right, were at the forefront of reflections for our founder and CEO at the beginning of Friendship Bench, when Friendship Bench was established. And grandmothers like Mbuya Nengo, Mbuya is a grandmother, Mbuya Nengo, who you are seeing on screen, have become a vehicle through which that world we imagine could actually be fulfilled. Friendship Bench works with community grandmothers in Zimbabwe. We train them to deliver therapy within their communities. That is our model. And if I can pause and share with you how this idea started. Our CEO and founder, Professor Dickson Chibanda, who was at that time one of only 3 psychiatrists in the country, had a patient under his rota, and that patient didn't come for a review. So he picked up the call to phone the mother and follow up on his client and say, "Where's Ethel?" So when he phoned and picked up the call, the mother said, "Unfortunately, Ethel took her own life." And in trying to find out, okay, so what had happened for you guys to not come to review? They didn't have money. A mere, I think, $10 stood between hope for Ethel and her demise. And the questions that Professor Dickson Chibanda was asking was, in what way can I take mental health into the community? We want to come up with an innovative, community-based, affordable, and accessible intervention that is within the community, because $10 cannot be what is between you and life. And the grandmothers were already a source of comfort for Professor Chibanda when his patient died. So his realization was grandmothers are a reliable, untapped resource. And you are probably asking as well, why grandmothers, right? Grandmothers within our context, right? I cannot speak on behalf of the whole African continent or on behalf of all Black people. But in Zimbabwe, grandmothers are custodians of knowledge. They are wisdom bearers. Our intervention is an indigenous intervention, right? Founded by a Zimbabwean, born in Zimbabwe, working in Zimbabwe. And it makes sense for us to implement indigenous knowledge systems into mental health, tapping into the knowledge systems of Africa, right? Dismantling health epistemologies, right? Who owns knowledge? We do. And we tapped into the idea of grandmothers because they're already revered in the community. They're able to practice deep empathy. They're able to hold space for vulnerability because they've already been doing that beyond being therapists, right? And because of the brain drain and moving out of the country, by health, skilled health workers, grandmothers are there to stay. They are not trying to go to greener pastures, to go to another country to look for a new job. So they are there in the community. And after that, after implementing and training grandmothers to deliver therapy, and they were doing that through sharing the cognitive behavioral therapy. And they were using 3 tenets: the problem-solving therapy, behavior activation, and activity scheduling. And after a while, they did a randomized control trial, because one of our values at Friendship Bench is that we are anchored in scientific research. So they did a randomized control trial, which tested the idea that could non-health professionals do this work? Could they actually deliver therapy in communities? So they had a cluster, 2 clusters of those that were being seen by psychiatrists and those that were being seen by the trained grandmothers. And the results were fantastic. Because already the systems was burdened, grandmother had better outcomes. They say better than Prozac. I've never tried Prozac. But yeah, that's what they say. So grandmothers had better outcomes because at the essence of it, it's literally saying, sit down, tell me your story, I'm listening. And since then, through university partnerships, through internships, through collaborations, over 100 scientifically published papers have been published for testing the idea of Friendship Bench through different modalities and through different interventions. So this is a clinic in Zimbabwe where our implementation teams are training grandmothers. Yeah. And essentially that what they are giving the grandmothers is tools to empower their clients, because problem-solving therapy is essentially saying, let me give you the tools to be able to come up with innovations or interventions that take you out of your situation. So after 3 to 6 sessions, the grandmother is allocated a park bench in a discrete part of the health facility in a community. They see clients, about 16 clients, 16 sessions a month that they're able to do. They deliver 3 to 6 therapy sessions per client and also do 6 weeks follow-up. We have a relationship with the government where we have a referral system from the clinic into and referred to the bench. For the high-risk clients, the grandmothers also refer back into the clinic for other specialized clinical and medication interventions. And to talk about context, I told you that context is key for Friendship Bench. To talk about context, our intervention is adopted to suit the local languages, right? In Zimbabwe, to tell people or to start speaking about depression, it's like, what does it mean? Either people don't know what it means or people use it so flippantly. Oh, yesterday I was so depressed, the bus left me. What does that actually mean? So we translated words like depression, anxiety into local languages, which would mean kuvura pfungwa, which are the basis of problem-solving therapy. Kuvura pfungwa, which means to open your mind, to start opening your mind. Kusimudzira, which means uplift. Kusimbisa, which means to strengthen. And kufungisisa, which means thinking too much, but also translate to depression. So people locally have a language for what they are going through. And that's how we're able to remove stigma as well when we do our sensitization and inform the community about the program. And just as a lead on to that work, we've realized that most people who come to the bench are women. And also the primary reason that most people are coming to the bench within our context is economical challenges. So we've started income generation groups and peer-led support groups that are facilitated by the grandmother after the client has been to the bench. So they're able to come together and continue to practice the problem-solving therapy tools and continue to support each other within these groups. And in terms of impact or what the program has managed to do, to date, 300,000 clients have been seen on the benches by grandmother. So you can imagine the impact of that. That means reduced stigma within the community, because if one person is aware of the impact of this, they have influence over their families, over their friends, over their community. And 2,000 community health workers or grandmothers have been trained. So you can imagine what that means in terms of filling up the treatment gap. Whereas we had 2 psychologists in that area, we probably have 100 grandmothers to date, which means more people are able to access mental health services. We are in 160 facilities around the country. We have formed 400 Seko Kubatana Tose groups, which are the income generation groups. We also have, so our randomized control trial showed that 80% of the people who were in that trial had gotten out of depression or out of risk of depression. And in 2022, of the 116 clients that we saw, 88% had showed a reduction in depression or reduction in the risk of depression. So it's a modality that works. So we have a 60% improvement in clients' quality of life, which are the follow-up sessions that we do with our clients to see how they are doing after they have left the bench work. We have been fortunate to be invited to 6 countries to replicate our model. which includes the London School of Hygiene and Tropical Medicine, where we are working in South London to address that same issue I was talking about of misdiagnosis of Black people, particularly around acute mental health challenges. So we're working in those communities to deliver an alternative modality that fits context. We've worked in New York too, with the City Health Department led by Dr. Gary Balkin under the Thrive program. We no longer were implementing the program, but the program was for the LGBTQ plus community and ex-offenders who were themselves trained to see clients within their constituency, right? So who the delivering agent does not necessarily need to be a grandmother, right? It can be a program officer or other delivering agents. So I'm going to, if you want to hear more about Friendship Bench and also in what way can we collaborate or take this idea to your area or an area near you or a recommendation of collaboration, I'm still around. We have been designated a room that is just across, if you go outside, it's just across the bar, the outside bar. I think it's called Gangino. That is on outside, and we can have a conversation. Lastly, I wouldn't be doing my job if I didn't ask this. I can see that I'm the only one who's made the call. I would love for you to join and donate to Friendship Bench. I've shared a QR code that is going to be available on the screens. And yeah, join the movement, join the revolution, whether it's $5, $10, I would invite you to join us and to create a friendship bench within walking distance for all. Thank you.
How about another round of applause for Zico? As I sat and listened to her speech, I couldn't help but think of the people that I know or have known who could have benefited from the Friendship Bench. So by all means, please join in partnership with them. And the Friendship Bench is set up in the Condedo Salon, just on the other side of the Gambino Cafe. You probably have noticed throughout the morning that there's a piece of art on the stage. Yes? Samuel Lind Hernandez is an inseparable to his roots in Loíza, the epicenter of Afro-Puerto Rican culture. Samuel is known as a renowned storyteller through his art. The stage features one of his pieces. And I know what you're thinking, Mark, how can I see more of his work? How can I, get some of that work? How can, because at first I saw it, I was like, ooh, I need that in my living room. Well, you can view and purchase some of his artwork in the Condedo Salon as well. And you see the Friendship Bench right there. See how we did that? All right. We're going to move this program right along. We're coming to the close of the days. Mas, a break. I'm going to take a short break right now. Stretch your legs and stop at DIR and give them a story.